Hello, my name is Selena Murphy, and I want to discuss how incivility affects nursing students in the online classroom. As the popularity and demand for online learning courses has increased, the role of incivility needs to be addressed and recognized. There is no set date as to when incivility actually began in the online classroom. Within the last 20 years, it has become more noticeable because more people are taking online courses. The reason why I selected this topic is because I will be a future nurse educator once I complete the PhD program of nursing at Walden University, and I want to look for strategies also how to deal with uncivil or unruly behavior of students in the online classroom. Now, instability is noticeably becoming a problem in the classroom, and faculty as well as students are both responsible for their own uncivil behaviors. And one of the things also to note is that faculty also are unprepared to handle incivility in the classroom. And there needs to be more education on how faculty should deal with incivil behavior of students. Now, the definition of incivility is the quality or state of uncivil behavior, or being uncivil, a rude or discourteous act, disregard and insolence of others, causing an atmosphere of disrespect, conflict, or stress. One of the things to also note is that due to the way society is, the millenniums feel they are more entitled to their behavior. So unfortunately, people think it's okay to be rude and disrespectful to each other as long as they get their way, is what society is now becoming. Now, some examples of incivility I want to go over with you is email etiquette. When someone types in all caps, it appears that they're shouting. Um, and you normally should not send an email if you would not say the same thing in person. So if you also need to think about proofreading your emails and really think about that email before you send it. Also, we have to worry about professional boundaries. Before, we only had to worry about professional relationships between faculty and students meeting in person. Now we have to worry about, with the advancements of technology, having relationships on social media. So those are also consequences of incivil behavior. Now there are different types of incivility behaviors in students. Some of them are when students provide negative feedback on teaching evaluations. They could be stalking other students or the faculty member. They could be intimidating other students or faculty members. There could be unjustified complaints against students or faculty. There also could be failure to participate in the course. They don't show up. I actually had a student sign in to an online course for like maybe 5 minutes the first day, signed in the last day, and expected to receive a passing grade. And I had to inform them, unfortunately, they were going to receive a failing grade because I knew exactly when, what date and time that they actually signed on, and they did not do any assignments or participate in the course. And they had a right to appeal it. Coming to class unprepared, students can make unreasonable demands, wanting to retake tests when they are not really entitled to that opportunity. It could be cheating on assignments, being disruptive to the entire class, or making personal or verbal attacks against other classmates. These are all different types of uncivil behavior of students. And when we look at faculty, they could be doing presenting lectures at a fast pace, permitting rude behavior of other students, acting aloof manner towards students, feel students are a burden, that they shouldn't be there for some reason in the course. The faculty member could be arriving late to class. They could be unprepared to present lectures or materials, or canceling classes without notice. It's all types of uncivil behavior of faculty members. Now, when you think about how incivility affect nursing students, the consequences of uncivil behaviors are widespread and often long term, including physical symptoms, anxiety, lower self esteem, and the use of drugs or alcohol. In addition, the victims of incivility suffer from cognitive defects, personality changes, weak communication skills, deterioration of self confidence, stress, workplace violence, or workplace complications. There's a high turnover rate of nurses. There's always a saying that nurses eat their young. It also, there's concern for patient safety. Will the rude behaviors fall over into the nursing profession when the nurse takes her first job? And is she able to handle the stress of the job? So that's one of the concerns about incivility behavior. Now, effects on higher education. Um, there's a concern that there's a downward curve of nursing ethics. Each year, I have to take a uh, two credit CEU on nursing ethics, but there may need to be more reminders of nurses that other professional standards that they need to hold up to. There is a nursing code of ethics by the American Association of Nurses. There are 9 standards that nurses should follow. And if you ask the average nurse, they may have been taught them briefly, but they would know possibly all of the standards. And recent surveys of patients voted nurses as the most ethical profession, as meaning nurses are looking out for patients when it's time to take care of them in the hospitals. But are the nurses truly ethical if they're condoning rude behavior to one another? Now, when you think about mental health and incivility, there are some worst case scenarios. There were 4 mass shootings that occurred, and 2 of them you might be familiar with was the Sandy Hook shooting and the Virginia Tech shooting. And there were also nursing students that actually failed courses and went back and shot their faculty members and some students. And the reason why um, this authorities think this happens because the person had mental health issues, and in particular, one of the nurse students that failed courses, also was going through a divorce, and they did not receive the type of help um, that they needed, and the faculty were unable to manage the behavior. So, possible solutions that we could think about um, for incivility is the instructor's role. They should review the syllabus and document any type of behavior that is considered not the not standard. Any type of inappropriate behavior has consequences, and they also should train and prepare instructors how to deal with incivility, and have a discussion with these students about the types of behaviors when they are inappropriate behavior. Sorry, when they're reading the course syllabus and how to conduct themselves in the online classroom, what is considered appropriate behaviors, and what the consequences are. And also, faculty should not ignore the behavior. It should be addressed promptly. And for nurses, in order to avoid patient safety, consequences of patient safety, where patients potentially harmed, they see a nurse being rude or having uncivil behavior, it's also to report that behavior immediately to their supervisor. One of the other possible solutions that is being considered now is what's called peer education strategy, where nursing students are going to be senior students in a nursing program. They will educate new oncoming students on what the appropriate behavior is for nursing and review the nurse's code of conduct. The goal is to bring awareness and understanding of how to be a professional nurse. And some of the things, the peer education strategy, the activities they would do is they would have pre and post questionnaires before and after the education is completed. They would have an active, reflective, informed approach to the policies. They would review professional standards such as the Nursing Code of Ethics, um, advise nursing students what the consequences of their behavior is, and let them know that uncivil behavior is not acceptable. Now, each state has their own state board of nursing. I currently live in Pennsylvania. Now, there was actually an incident where a state board of nursing was threatening to close a school because there was a lot of rude and uncivil behavior of the nursing students, and they needed to prove that there was interventions and strategies in place and the evidence of enhancing student-faculty relationships in order to prevent school closure. Now, the Joint Commission is also known as JACO, and they do audits of hospitals and nursing homes. And in 2009, there actually was a Sentinel alert where they were saying healthcare providers need to be responsible for their own behaviors. Discourteous and disruptive behavior of healthcare professionals can have a negative impact on patient safety, quality of the care provided, and employee satisfaction. So basically, Jacob was trying to inform providers that we need to start with new nurses in colleges and nursing programs to educate them on what the appropriate behavior is for nurses. Now, if you think about what role a nursing organizations can play, I belong to several. I belong to the National League of Nursing. I belong to Senate Data Tau that's listed there, and the Case Management Society of America. But I listed a few more. And in addition to my membership, I should consider a leadership role, teaching other nurses about ethics and what being a nursing professional means, and being more active in my organizations, and leading the charge basically to inform nurses of what the unruly behavior is and how to treat each other professionally and respectfully. Now, going back to mental health, we should trust our gut feelings, consult our supervisor colleagues for assistance. Actually, have a colleague sitting on the class if you think there's a student that you're having an issue with, and share emails or essays from the students with other colleagues or your supervisor to get a picture of what is going on with the student in the classroom. And if you think a student needs counseling, either refer them or walk them over to the counseling center that's available on on the campus. And if it's more of an issue where the student may want to harm themselves or others, you may you have to call the local police and the campus police to address that also. While there's many graduate programs that do offer the opportunity to teach, and they have some training in place, most graduate programs spend more time talking about how to teach the content of a course than mastering the discipline of interpersonal communication skills that are necessary to teach effectively and to handle incivil behavior. Even graduate programs don't provide specific courses on how to teach. They focus often on the best way to deliver the content, apply teaching techniques, and the use of technology to promote learning. Typically, far less emphasis is placed on teaching new faculty how to manage the interpersonal dynamics they're going to face in the classroom. So, faculty is unprepared to handle the civil behavior, and when nursing students go through programs, if they don't know what's expected of them, they are going to continue the uncivil and rude behavior. So, in conclusion, incivility can affect online learning environment. It can cause a stressful environment for everyone. Faculty and students are responsible for their own behaviors, and they should know what the consequences are of the unacceptable behavior. And discussing what the behavior is acceptable in the beginning of the course by going over the syllabus and have a code of conduct in place can prevent uncivil behavior and nursing students going out into their place of employment and unfortunately affecting the type of patient care that they are providing. Here's all my references, and I hope you have a good evening. Bye.